Greetings, family. Good morning, good afternoon, good evening from every part of the world that you're watching me. I am Genevieve Ngum. I'll be talking to you on stroke. Yeah, stroke. Stay tuned and watch. Don't miss out what awaits you. Welcome back. So, what is stroke? Stroke is a condition that reduces blood flow to the central nervous system, especially the brain. Stroke affects about 13.7 million people and kills about 5.5 million people annually. It ranges, the age range of people who are affected by stroke, you can have a range between 20 to 54 years. And for gender, we know that some people will say it affects women more than men, while others say it affects men more than women. But this is it. Between the early stages of the female, that's 20 years to about 40 years, it's very prevalent for them to have stroke. Whereas for the men, the older they get, the higher their chances of having stroke. Whereas for the woman, the older you get, your chances of stroke are instead reducing. There are some common types of stroke. We have ischemic stroke. Ischemic stroke here is deficient blood supply to the brain and the lack of oxygen to the brain. We also have hemorrhagic stroke, which is as a result of leaking vessels. That's vessels that supply the brain. They are leaking, so enough blood does not reach the brain. Okay, now what are some causes of stroke? Some causes of stroke here we have deficient oxygen and nutrient supply to the brain. When there is deficient oxygen and nutrient supply to the brain, it causes the brain cells to start dying, and when they start dying, the brain does not function well anymore. Also, we have lack of blood supply to the brain. When the brain does not receive enough blood to perform a particular function, the body itself does not function well. Also, another cause of stroke can also be bursting of or leaking of the blood vessels. That's when the blood vessel bursts or is leaking. Enough blood does not reach the brain, and when enough blood does not reach the brain does not function well, and leading to malfunction of the whole body. And we know that the brain controls the body, so if the brain does not function, every other part of the body does not function well. Okay, now, what are the risk factors of stroke? We commonly have risk factors. We have hypertension. Hypertensive patients are at a high risk of having stroke. We have diabetes. Diabetic patients are at a high risk of having stroke. We have this smoking, tobacco intake. Those take tobacco intake, they are at high risk of having stroke. We have smoking, lack of exercise and proper dieting. We don't just eat and you don't exercise. Poor nutrition. Then we also have genetics. It is inherited. So we have age. Stroke varies with age. And also in some pregnant women are at risk of having stroke. These people, contraceptives too, taking contraceptives and hormonal therapies can also lead to stroke. And also other heart diseases. Heart diseases are a risk factor, high risk factor of stroke. The signs and symptoms of stroke. How do you know that you have stroke? You have difficulty in walking, that you cannot walk. Maybe when you stand to walk, you cannot move your legs. You have paralysis on one side of the body, like one part of the body does not actually function. Maybe you try to lift up your hand and it's like you don't feel your hands, like your hand cannot go up, your leg cannot walk. You also have blurred vision. You can't see images clearly. You have doubled vision. You see a single image 2 times. You also have difficulty in talking, like you face difficulties when you want to talk. Maybe you're talking and your mouth, the shape of your mouth is not as normal, it's not symmetry with your face. You also have difficulty in understanding. Someone might explain something to you over and over and you cannot understand. You also have mental confusion. You're just confused, you don't know what's happening, but you're confused. And you also have numbness of the limbs, that's the hands and the legs. You just feel cold, you feel like they are not functioning. And also you have poor touch, when that's you feel when someone touches your hand, you have poor touch sensations. When somebody touches a part of your body, you don't feel it. So let me say you touch your hand, you don't feel your hand, you pinch and you don't feel anything. So you lack that sensation, that touching sensation of you. And then also you have fatigue, lightheadedness, and also difficulty in swallowing. You want to swallow and you cannot, not like a sore throat, but you just face difficulties in swallowing or chewing as well. Stroke. That's how do you free yourself from stroke. You need to take healthy diet, healthy food and dieting. That's what you eat. It should be healthy. You need regular exercises. Yes, you need regular exercises. You need to quit smoking for those who smoke. Quit smoking. You limit alcohol intake. Control blood pressure for those who have. Control diabetes for those who have. And for blood pressure and diabetes, those who are already having diabetes and blood hypertension, you should take your drugs regularly. At least when you take your drugs regularly, it might stabilize it and reduce your risk of having stroke. And also, you should keep a healthy weight. Obesity is also a risk factor of stroke, so you should keep a healthy weight. Now, for regular exercising, people do exercise which are not needed by the body. As an adult, adults are supposed to do 2 hours 30 minutes of moderate exercises per week. That's 2 hours 30 minutes per week. This moderate exercises, we talk of walking. You can walk every day, maybe 30 minutes, but weekly it should be 2 hours, 30 minutes. So just walking as an adult is exercise. Like, you should learn to walk. Don't take cabs from here and there. Walking. When you walk, you stretch your body, just light exercises for your body. And for young children and teenagers, need 1 hour of exercise every day. That's 1 hour of exercise every day, making 7 hours of exercise a week. Okay, now we go to nutrition and dieting. What does the body need to fight against stroke? They say eat food low in saturated fat and cholesterol and high in proteins. These foods that are low in saturated fat, we have poultry, this what we call chicken. Fats that the skin, it has saturated fat, so don't eat poultry with skin. You peel off the skin and eat the white skin, the white flesh inside. You don't eat fried fish. Eat mostly boiled fish, and also eat foods high in fiber. High fiber foods. You have fruits, you have vegetables, you have nuts, all nuts. We have grains, so eat grains. And also you should eat salt-free spices. You have turmeric, black pepper, and avoid processed food. These foods, canned food, no, eat whole food, foods that are being cooked by yourself. Don't eat canned food. And above all, drink enough water. That's at least 2.5 liters of water a day. That's at least. Drink enough water daily. Also, you need to limit salt intake. You limit the amount of salt in your body, because salt has sodium, it contains sodium, and sodium increases water retention in the body, which increases the amount of blood in the body. Sugar, no sugar sweetening drinks, all these sweet drinks, you need to reduce them, and you take at least a glass of juice. Okay, to conclude, if the brain does not receive enough nutrients and oxygen from the blood, it can lead to long-term disabilities or death. Thank you all for your kind attention, and if there are any questions, you can drop them in the comment section. Thank you.